Thank you today for coming and letting me the chance to show you how to use a blood glucose meter. At this point, you have to make sure you have all your equipment, which is really basic. You have your glucometer, you have your strips in the right range of date, you need your microlet to prick your finger, and you need some lancets as well. So the first step would be to load your microlet to make sure it's ready to be able to draw the drop of blood. And it is a capillary drop that we will get, and this should be very similar to the blood test that you get at the lab. At this point, we will load the machine with the strip. The strip needs to match the glucometer machine. And at home, in the comfort of your home, I really recommend that you wash your hands under lukewarm water with soap, dry well, and then you're ready to do your test. Here, in this setting, we'll use an alcohol swab. And you can use any finger that is your second, your third, or your fourth finger. Usually we leave alone the thumb and the little finger. So once your alcohol is dry, you would prick your finger, and usually on the side of the finger. And at this point, we need a bigger drop. So we will just make sure okay, and you let it come slowly. You don't need very much. This machine takes a very little amount of drop of blood. You would bring your machine to the drop. There's 5 seconds, and it will give you your result at this point. So your doctor will help you set up your target. Depending if it's before a meal or 2 hours after a meal, the target will be a little different. And depending on what you take for medication, that it is oral medication or you take insulin, you may have to check more often or less often, depending again. And this is good to set with your doctor or your diabetes educator. So thank you again for coming, and I hope you enjoy using your machine.